Every year, over 21 million adults in the US experience depression. That's about 1 in 5 people. What if I told you everything you think you know about depression is wrong? That the people you think are fine might be falling apart inside? That you might even be struggling and not realize it? These myths are everywhere. They keep people silent. They keep people sick. And sometimes they cost lives. Here are 5 of the most common and most harmful myths about depression that you still believe. Myth number 1, depression is just sadness. Ah, yes, the classic everyone gets sad sometimes. Sure, everyone does. But not everyone loses their sense of self. Not everyone wakes up with a 200-pound weight on their chest every single morning. Depression isn't just being sad, it's a diagnosable mood disorder that affects your brain, your body, and your behavior. According to the National Institute of Mental Health, symptoms include persistent feelings of hopelessness, fatigue and low energy, trouble sleeping or sleeping too much, changes in appetite or weight, difficulty thinking or focusing. And here's the kicker. Over 2/3 of people with depression also report physical symptoms like headaches, back pain, or stomach issues. So no, it's not just feeling a little down. Depression is like trying to run a marathon in quicksand every day. Myth number 2, you can just snap out of it. Yes, the old just go for a walk fix. Have you tried yoga? Just think positive. Have you considered smiling more? Look, self-care matters. Exercise and sunlight help. But telling someone to just snap out of it is like telling a laptop to reboot with no power. Depression involves neurochemical changes in the brain, particularly in serotonin, dopamine, and norepinephrine levels. It's not a mood you can will yourself out of. Studies using fMRI scans show that the brains of people with depression literally function differently, especially in the amygdala and prefrontal cortex. So no, Janet, I can't just vibe my way out of clinical depression. That's not how brains work. Myth number 3, depression always has a cause. People love to play detective when someone says they're depressed. Did something happen? But your life is so good. Here's the truth. Not all depression is situational. Sometimes it just shows up, uninvited. No breakup, no trauma, no plot twist. According to the American Psychiatric Association, up to 50% of major depressive episodes occur without an obvious trigger. You can have the dream job, the dream relationship, and still feel absolutely hollow inside. That's not drama. That's depression. And when we tell people you have nothing to be sad about, what they hear is, your pain isn't real. Pro tip, never invalidate someone's pain just because you don't understand it. Myth number 4, antidepressants are a sign of weakness. Let's talk meds. Cue the judgment. Somewhere along the line, society decided that treating your brain chemistry is weakness, but treating high blood pressure is just being responsible. Let's fix that. According to the CDC, antidepressants are one of the most prescribed medications in the US. And for good reason. 40 to 60% of patients with moderate to severe depression see improvement with medication. No, antidepressants aren't magic pills. They don't make you happy, but they can make life manageable enough for you to pursue therapy, reconnect with people, or just get out of bed. That's not weakness. That's a comeback story in progress. Myth number 5, people with depression always look depressed. This one might be the most dangerous of all. Depression doesn't always look like crying in the dark. Sometimes it looks like your funniest friend, your most organized coworker, your favorite YouTuber. Enter high-functioning depression. Or if you want the clinical term, persistent depressive disorder. People with this form often go years smiling, performing, parenting, while privately drowning. In fact, many people with depression don't get diagnosed for over 10 years, according to Mental Health America, because they don't look the part. Reminder, if we wait until someone looks obviously broken to believe they're hurting, we've waited too long. Ask twice, check in, and believe them the first time. So here's what we know. Depression is real. It's treatable. But the myths around it, they're deadly. They keep people ashamed, isolated, and silent. Let's change that. One conversation, one truth, one video at a time. If you're struggling, you're not weak. You're not broken. You're human, and healing is possible. If this video punched a few myths in the face for you, or made you say, wait, is that me? We've done our job. Go ahead and click that like button. It feeds the algorithm and my serotonin levels. Drop a comment with the myth you used to believe, or just leave a brain if you're processing some stuff. And if someone came to mind while watching this, share it. Quietly, kindly, maybe even anonymously. You never know who's pretending they're fine.